Okay, so we are in, I guess. Slide. Great.
Yeah, am I audible properly? Yeah.
Yes.
Okay. Yeah. I think just last 1 minute, then we can start.
Yes.
Mm-hmm.
Right. Perfect. So it's working also in.
Okay.
Yeah, I just got a message from Zoom that it's been working. So I think it's just 1 minute. I mean, let's just see if anyone, YouTube, just let me check one more time.
Mm-hmm.
Yeah, it's working. So let me just share it in my Facebook.
Mm-hmm.
So let me share in my PLAB group.
Mm-hmm.
All right, great. Okay, so I hope some audible. So thank you so much, everyone for joining the session. We have a session today on basically it's on PLAB, more confined to PLAB 2. So a lot of interesting things we discussed. Along with me, it's present none other than Dr. Ankur. We know each other for now a few years. Actually, that time he came to Bangladesh, we have very good connections since then, actually, and always been talking. So I was telling him many times to do a seminar. So that'll be a great pleasure to have him. So I think that's the day. So I think he'll give all of you the latest, most information about the PLAB, especially as I say, like more towards PLAB 2, and also the structure of the exam, how much it has changed in during the COVID. We often also got some questions from the students like regarding is it like the same? Is it changing to UKMLA? This is another question we often got. So we'll also talk about that one. And also, Dr. Ankur will give you guys a little idea about the visa, and at the same time, how people are going to UK these days, whether they're having any problem or not. And we'll give you a little idea about the quarantine process too, actually. So it's all yours now, Dr. Ankur. So welcome.
Right. First of all, thank you so much, Dr. Shahiyar Ahmad, for giving me this opportunity. And yes, so regarding PLAB, I mean, he's also getting a lot of questions. I'm also getting a lot of questions. We'll try to solve all your queries. And if you have got any query which was not answered during the session, that you can put in the comment box, and we'll be more than happy to answer that. So let's start. And I think we'll be taking like half an hour this session. So first of all, I'll just introduce myself, Dr. Ankur Garg, and I've done my MBBS from India, and then I did my internal medicine from University of Buckingham in the UK. And this is my email ID and contact number. So let's see the UK pathway. So first of all, I mean, if we want to get registration in the UK, first of all, we need to do this English exam. We have to do this IELTS or OET. So recently, I mean, from last 1 or 2 years, they have introduced this OET as well, which is actually easier than IELTS. So it's entirely up to you which exam you want to give. So either IELTS or OET. After that, once you are done with this exam, then you need to make like your profile on the GMC. Just register yourself, and then only you will be able to book your PLAB 1, right? So book your PLAB 1, you have to make an account on the GMC, and which will only be possible once you are done with your IELTS and OET. So once they have seen that you have done your IELTS or OET, the PLAB 1 window will open, and then you will be able to book your PLAB 1. Once you have passed PLAB 1, then only you will be able to book your PLAB 2. So this is how it works. So for IELTS and OET, so for IELTS, what are the requirements? So the requirements are straightforward. You need to get a 7.5 overall bands. IELTS in total, they have got 9 bands. So you have to get 7.5 overall and 7 in each. What does it mean? We have got 4 domains in English exam. One is listening, then other one is reading, and then writing and speaking. So individually, you need to get 7, but overall it has to be 7.5. So for example, if you got 7.5 in 2 of the domains, maybe listening or reading, and you got 7 in rest of the 2, maybe in writing and speaking. So overall, it will be considered as 7.5, right? So 7 in each, 7.5 overall. And this OET, as I said, it's easier in comparison to IELTS. In this, you need to get B in all the modules. Again, here also we have got 4 domains, which are listening, reading, and writing and speaking. So in all 4 domains, we have to get B. So that this is the requirement for OET. Why OET is a bit easier than IELTS? Because OET is occupational English test exam. So whatever the questions, whatever things they are going to ask, that will be related to medicine. So we are doctors, so we know we can easily find things. For example, in the reading, we can talk in medical language very easily. So that's why it becomes easy. Whereas in IELTS, you can get any topic. You can get topic maybe from politics, you can get topic from sports or anything. So that's why sometimes it becomes a bit tricky. So if you ask me, I would say OET is best. However, it is entirely up to you, whichever exam you want to give. Both are accepted by the GMC.
Yeah, I mean, the suggestion here, I guess, is to finish it early. I think that's the suggestion. Whatever you choose, do it early. Because I also saw a lot of, students. They have been planning. They're planning. Never ends. Actually, it's just keep going. So it's the number one initiative, which I can tell from some of my experiences. Better, you try to start giving some mock test on English test to any of your nearby center. So once you start the process, you'll get some confidence, or you'll get to know where is your weakness. So in that case, you can get that confidence actually. And do not take more than 2 months for this sort of exams. So 2 months, 2.5 months. To be honest, I mean, like I did it in just in a month. So most of the doctor take in that particular time, and otherwise 2 months. Often I got a question that, how much time is the standard for this English? I say, for an average person, 2 months is enough actually. Just if you want to play safe actually. But if you're in a hurry, 1 month is also enough actually. So it's up to you now. Yes.
Yes, and actually another question is some candidate ask, like OET is a bit expensive. Yes, it is expensive than IELTS. However, what I have seen when candidates they're appearing for IELTS, they might be appearing for 2, 3, 4 times. So it's always good if you give OET maybe once or maybe maximum twice, you will be able to do that. So again, I think OET is.
I also found some candidates appearing in OET 2, 3 times actually. So I can also imagine that. Even the PLAB 1 cost and it equals to that OET cost, the part 1. So so please make sure that you clear that OET in a one go. It's not that tough exam, first of all, actually. So it's always possible. You just start working hard from today. That's most important.
Yes, definitely. And in regards to GMC, what used to happen? So there has been a recent change by the GMC. If your IELTS OET is more than 2 years old, you can still demonstrate that you have got English exam proficiency. What does it mean? For example, after OET or IELTS, you are done with your PLAB 1 and PLAB 2. So before COVID, what was the thing? Within 2 years of passing your English exam, you have to get the registration. Otherwise, they will not give you registration. So what you need to do, you need to give English exam again. That is the protocol. However, because of COVID, they have made changes here. The reason being because lots of candidates, they were not able to travel, so they're not getting the dates for PLAB 2. So, I mean, the date they passed IELTS or OET was like maybe around 2 years or more than that. So what GMC has done, so from now until March 2023, or they may extend it later on as well. So what they say, the IELTS or OET score will be valid actually for 3 years. There is one condition, that if you have passed PLAB 2 in less than 3 months before you apply to join the register. So I'll explain it in easy words. See, PLAB 2 is about the communication exam. So PLAB 2 itself, if you have passed PLAB 2 in last 3 months, that will be considered as your English efficiency exam. So now IELTS and OET will be valid for 3 years till March 2023. Right, so you are done with your PLAB 2, straight away apply for the registration. So even if IELTS and OET 3 years old, they will consider, and the GMC automatically their system will consider it. If there is any trouble, maybe you can email them. However, for 3 years now you are safe in terms of IELTS and OET, because many candidates, they're okay to give PLAB 1, PLAB 2. They feel it's easy because, of course, all of us are doctors. It's easy for us to do PLAB 1, PLAB 2, but sometimes candidates, they do face a bit of trouble in IELTS or OET. Now I think it's a good news from.
It's boring sometimes, in my word.
Yeah. I mean, if you're preparing for PLAB 1, it's our field. We feel like
our field,
getting more
yes.
particular subject. But
yeah, when I was doing IELTS, I told my wife that this is the first time in my life, I get bored studying. Actually, she knows that I have this study or like to study, but those are the medical things. But suddenly, I mean, those things were a matter of interest during our school and colleges. So after that, we don't give a second thought about these tense, small things. Actually, especially in writing. Yes, so especially writing habit has changed a lot for us actually. So we need to consider that actually. But this was a very important information that I think many will be benefited to know that and it can be considered 3 years, but some condition apply that the deadline if it's like from now up to March 2023. So that means if someone is finishing their PLAB 2 by 2022, even in the middle, and quickly apply for the GMC registration. That means I think the GMC registration takes like a month, I guess. So that actually even some cases more faster for some people. So I mean, in that case, I mean it will be done, I think. So no need to go for again that whole English test series and the things actually. Even if I just rewind this thing and go back, there was a time. It's not only the IELTS. I mean, WET introduced, from this 2000, I think, 19, I guess, for the PLAB. And there was a time before, since 2019 or just before, UKVI people have to give, some of the tutor I also know, they also, give the UKVI to, get the job and, finally for the registration. There was also time like that, actually. I wanted to ask you about that one. What's the benefit of having, though it's a side question, but we do get sometimes actually, any extra benefit of giving UKVI? I mean, considering for long future, because some of them are very good in English, maybe from English medium background and things like this. Still, they have to give the exam because English might not be first language. But their study, if is in English medium, they are already very good.
No. See, UKVI is also the same. There's nothing different. But what happens when you go for UKVI exam? They do check you very thoroughly. They make some videos and everything. So mainly when you're applying for tier 2 visa, so you need to show that, yes, I am good in English. So that is why you have to give UKVI. But now what they have done, like for the doctors, they know that
yes.
they have done their IELTS general one, and they have already done their PLAB. So as a doctor, if you're joining NHS, you don't need to give UKVI. However, if you are coming on any other visa, maybe business visa or whatsoever visa you're coming to the UK, you still need to give UKVI. Again, it is the same. So when you are actually giving IELTS or OET for maybe GMC registration, so you can give normal IELTS or you can give IELTS UKVI. It is same. There is not much different. It's just like they will have more of video recording and all those kind of things. Nothing much different actually.
True.
Yeah,
all right. So
listening.
So nothing extra special. I mean, go with the OETs, all done actually. Yes.
Yeah.
So right.
Within 3 years, you can just use that and just do your PLAB and PLAB 2 as soon as possible.
Right. Yeah, I think we'll be more interested to know. I mean, conversation with Dr. Ankur, especially we're talking about the PLAB, and then also especially highlighting the PLAB 2 mostly. And currently, Doctor, I'll be also interested to know, and also I got some of the inquiries actually, how much it has been changed. I mean, its format. So what's the basic format, and what's it has been changed since, I mean, this COVID thing has started. So if you just highlight that part, would be great.
Yeah, so I'll explain both PLAB 1 and PLAB 2, like how much they have changed since COVID. So PLAB, all of us, we know, like it's a professional and linguistic assessment. That's the full form for PLAB. So it has got two parts. Number one is your PLAB 1 MCQ, and PLAB 2 is OSCE exam. So usually they are going to check your, you can say, medical knowledge here in PLAB 1. So they will be giving a question which has got 5 answers. You need to choose the right one. PLAB 2 is, of course, they are going to check your medical knowledge, but mainly I would say this is for communication. They are going to check our communication skills here in PLAB 2. So let's see a bit more. First of all, where this PLAB 1 is held. So PLAB 1 is there, of course, in the UK. In the UK, we have got many centers. I would say there are 3-4 centers in London. Then we have got 2 centers actually in Manchester. Now they have got center in Belfast. They have got center in Cardiff. So they have got many centers, I would say, in the United Kingdom now.
So no issues, I mean, getting a date, especially if someone is living in UK.
Yes,
right.
For someone in the UK, it is not tough. Now, if we see overseas, they have got centers again in many countries. So for Bangladesh, if you say there is center in Dhaka, and there are many centers in India. Like in India, we have got 5 or 6 centers. Even candidates from Bangladesh, they can travel to Colombo as well. There is like center there as well. Plus, there are centers in UAE, Middle East, so they can travel there as well very easily. But initially it used to be very clear before COVID that there were 4 sets of exam in 1 year, and all 4 will definitely happen in the United Kingdom. So one used to be in March, and then June, then September, and then November. Fixed 4 exams. And out of these 4, 2 used to happen overseas as well. For example, like the November and the March one were always overseas as well. However, now what is happening because of COVID, they had to cancel lots of exams. So now actually on overseas centers, actually all the exams are happening. So if you ask me now, even all 4 exams actually happening in some centers overseas, not all, but on some centers overseas. So, but now also they are not following those March, June, September, November.
Yeah, that's because I've been tutoring this PLAB 1 for a while, so I know. I mean, even we never found a month that was October. So, but in October there was also exam. So some cadets were telling, no, we have exam in October. Are you sure that exam in October? I mean, because they were requesting something. So. No, it's in October. So how come October came up now? We never heard that October is for PLAB 1 at least. So because of these changes, there's a lot of shifting and also rescheduled. It's better to say the right word. Rescheduled a lot of exam, and they have been. So one more word here which I like to add is like the priority. If you were a PLAB 1 candidate, and for example, if you're going to have exam in this coming, say, November, and if in any case accidentally if the center has been cancelled, now you'll think, okay, I'm living in Bangladesh, it'll be very tough to get a date again. So in that case, it's better still to take the date early, because you will be given the priority next time actually. So there is now a group, it's called the priority group actually. So if your exam is cancelled, there are some backup seats in actually even in the February or March, whenever they will take it again. So you will be transferred to that part as a priority. So that means the next one is coming, you can actually take that exam that time actually, if situation is under control actually. So that is an additional information.
Yeah, so I mean, actually, PLAB 1 is happening 4 times in a year. But last year, actually, they took 5 times. So there was an exam on September and November, but then they introduced October 1 as well. That's an extra one. Because of COVID, they had to cancel on many overseas centers. So that's why they took 1 extra date. So this is like they keep on changing. Initially, yes, before COVID, it was fixed, but now it's not fixed. There are like little changes here and there. So regarding PLAB 1, now what we have got is like you get 4 attempts of like maximum 4 attempts that you can give. So we have got 180 questions. So you get 180 questions and all questions have got 5 answers. You need to choose the best answer, 1 best answer. And the exam is happening for 3 hours. So 180 question for 3 hours. And passing is like roughly, I would say 120. So if you're getting like 120 or more than that, that is definitely you will pass. And the good thing is there is no negative marking. There is no negative marking. So the thing is 180 questions, just 1 minute for one question, just do it. Even if you are not sure, just mark the answer, because there is again like 25% of probability, like it will be fine, isn't it? So roughly 120 plus, if you're getting out of 180, you will pass. So maximum 4 attempts, 180 questions, and 3 hours, that is you are going to get. And if I tell you like roughly around 2 years ago, the number of questions used to be 200, but then they reduced
Yeah.
it to 180 because
Yes.
there was a exam which was quite lengthy, and a lot of candidates, they emailed the GMC that we were not able to finish the exam. So they considered it, and from the next time they made it 180 questions. So from that time, 180 questions are coming, and you're going to get 3 hours, and just try to score around 120, which is like safe. Even if I tell you like last time it was around 115, the passing score, but still I
Yeah.
have kept it like 120. If you get 120 or more than that, definitely it's a
Mhm. Yeah, I mean, I figured out it varies from in last
Mhm.
3 years of my experience. I have seen it's like moving from 115 to 125. That's the
Mhm.
range, not beyond that actually. But you say the correct one, 120 is the average actually if we
Mhm.
count all of them.
Yeah, so roughly like this, if you get it's passed. And again, you can mark every single question because there is no negative
No
marking.
negative marking, yes, actually. So finishing exam is a priority actually. It's very important. Like you should finish the
Yeah.
exam properly actually.
Mhm.
So that's very important.
And one extra thing is like it's not computerized exam. It's like you have to go in person and you have to
Yeah.
mark it on the paper, on the OMR sheet. So that also take extra, maybe I would say 15-20 minutes. So that is also thing, because candidates, they are mostly preparing maybe online thing and all, and they don't realize that
Mhm.
they need to have these 15-20 minutes extra for marking their answer on the OMR sheet. That is really important. So I would say when you're preparing, make sure you have got maybe 160 minutes. So you can have like 20 minutes extra for marking your answers, and that's really important. And exams, so PLAB 1 is like, so what they're going to get important topics like some acute conditions like anaphylaxis, acute exacerbation of asthma, COPD, so these kind of things. Lots of long-term condition like diabetes, hypertension, what are the guidelines they are following in the UK, what kind of scenario in the A&E, for example, like a patient of pneumothorax, or how we are, I mean, going to manage them. So they have got their protocols. So we have to like make sure we know all those protocols. So only then you'll be able to answer the questions in the exam. They might be giving you like 3-4 questions in terms of ECG. Some questions might have X-rays in it, and there are some dermatological images as well in the exam. So all 180 question will be from every single field. Like this is a like general exam, so you'll be having questions from medicine, from surgery, from gynae, from pediatrics, psychiatry, everything. Now, days you will see like from last few times they have introduced lots of ethical questions as well.
Mhm.
Ethical guidelines, we have to be very clear, like what is the age of consent, confidentialities, lots of things are
True.
there in the UK. For example, if I just give you an example, like in our country, say it's Bangladesh or Pakistan or India, if a patient has got a problem, say cancer, we don't tell the patient usually, we tell their relatives and
Yes.
what
I use that example so often. Yeah.
so that's the thing. And I always tell in my class, so maybe patient will get to know when he's dead, oh, I died because of cancer. He doesn't know.
No, so true, actually.
Here in the UK, the things are different. You have to tell it to the patient first. And if patient feels like discussing with others, and if patient gives consent, only then you can discuss things with others or maybe family members. Otherwise, not at all possible. So that's why
Right.
like, these ethical guidelines are also very important to pass the exam. So we get many questions in PLAB 1 regards to ethics only. So
And
let's
I think recently we also see some, previously also used to came, but we have seen one, two question maybe raised a little bit on the biostat as well. We have seen. I
Mhm.
mean, new, I mean, what they're adding actually, so that's one of the possibility there. If they want to make it little hard in near future, in some cases, they might increase those biased type questions actually. So make
Yeah, that.
sure, I mean, if people are preparing, make sure you prepare well on the psychiatry, ethics, and the
Mhm.
biased, because these are the three things. Because I have been tutoring for a long time, even if you're tutoring PLAB or whatever. So most of like the Asian, the medical students, they're not familiar with much of psychiatry, not much of ethics, not much of the bias type thing. Okay, so these are the three additional things I like to add, that even if you're a fifth year or fourth year, and if you're watching this video, even later if you're watching, it's very important that you work on these three, because medicine, surgery, gynae, our professors are also very smart enough. So eventually, you become quite experienced on those major fields. Actually, a lot of lectures, seminars, and a lot of workshops happens. But on psychiatry, ethics, and bias study, hardly you'll find seminar, workshop, and things like that. Actually, people don't take much interest. Actually, so just as an extra tip for the freshers.
Yes, yeah, definitely, you are absolutely right. And then like a PLAB one is simply like you have got like a short scenario they give, and then they give you like 5 options. You need to choose the right answer. So for example, let me show you. I just took it from the GMC only. So for example, a patient is there, like 22 years old man, and he has got acute painful red right eye with blurring of vision for last 1 day. He had a similar episodes 1 year ago, and now he has had this episodic back pain as well. So now you found out there is something systemic happening, back pain with the stiffness that was relieved by exercise and diclofenac for last 4 years. What is the single most likely cause of his red eye? So something like this question you will get, and they have given 5 answers. Chorioretinitis, conjunctivitis, episcleritis, iritis, keratitis. So you need to choose the right answer. So here maybe you can try making the diagnosis what's happening. So eye problem with the back problem. So the answer here is actually iritis.
Iritis, yeah, because vision is also affected. Yeah,
which is yeah. So I mean, not very tough question, but if you have done it like maybe question bank one, so it becomes easy. It becomes your reflex.
Little trick. Many, especially those from MBBS background, might think about conjunctivitis and things like that. But as I said, like Doctor highlighted those additional parts, like relieved by that, and at the same time, red eye plus blurring of vision, so the vision affected. So that goes with the iritis.
Yeah. So all the questions like will be like this in PLAB 1. So they have got a scenario, and after that you got 5 options. You need to choose the one right answer. And again, I'm saying no negative marking. So just give the answer. Even if you're not sure, just give it. Still 25% of the chance or 20% chances are there you will mark it.
True.
But most of the time what happens, like some candidates, if they're struggling with certain questions, mostly what I've seen, they're able to rule out 3, but they are confused in and like
2 actually. This is the most common scenario that we get confused between 2. Yeah. So that means the 50% chance that you will make it. Yes.
Yeah, 50% that you're gonna get it right.
Yeah.
So that's the good thing about PLAB 1, that there is no negative marking. Whereas like most of the exam that we are giving in our countries, they have got negative marking. So we hesitate, we think 10 times, should I mark it or not? But here, just mark it. So that's a good thing. So that's about PLAB 1. So if you see a bit more about PLAB 2, where is this PLAB 2 held? So the thing is only and only in the United Kingdom. There are no overseas centers at the moment. So they have got actually only 2 centers, I would say, and both the centers are actually in Manchester. Last year, I would say 2 years back, they actually introduced some temporary center in London and Cambridge as well, but that was, I think, for 3 to 4 months only, not for a very long time. Yeah. So now we have got only 2 centers, and both are in Manchester. One is actually 3 Hardman Street, and the other one is actually the same, 3 Hardman Square. Actually, they are just very close, just 1 minute from each other. So these are the 2 centers they have got at the moment. It's in central Manchester. So only these 2 centers they are doing exam. Overseas, there are no centers. The reason being, as you know, PLAB 1 is, it's a MCQ question. So that can be done. But for this, you get like actors there. So you'll get some British actors. So they'll be talking to you, and you'll be taking histories from them. You'll be doing some ethical scenarios with them, some counseling scenarios. So that is why it is a bit difficult to conduct this kind of exam in overseas centers. So that's why they have got centers only and only in the United Kingdom. So again, for PLAB 2, the same, we have got 4 attempts. We have got 4 attempts for PLAB 1, and same 4 attempts we have got for PLAB 2. So now I have actually divided into 2 parts. So it is, I would say, before COVID, and now
that's a very nice slide.
So this is after COVID. So little
Yeah.
bit of like differences are there. So in PLAB 2, what happens? Initially, they used to have 18 stations and 2 rest stations, meaning in total 20 stations used to be there. Stations, I mean, you will get 18 different patients and you will be taking their history and doing examination. And some scenarios, they have got some mannequins as well. So maybe you have to take blood sample from a mannequin, you have to put a catheter in one of the mannequin. So that used to be the thing. And again, the scenario will be from every single field. The scenario will be from, again, medicine, surgery, gynae, pediatrics, psychiatry, lots of counseling scenarios, lots of ethical scenarios we have got here in PLAB 2. So 18 different patients you used to get and 2 rest stations. So in 18 station, and one station takes roughly 10 minutes. 8 minutes with the patient, 2 minutes you get to read the task, or 1.5 minutes actually to read the task. So roughly 10 minutes for one station. So 18 station, and in between you get 2 rest station where you can have a glass of water and you can just relax for 10 minutes. So the exam used to take 3 hours 10 minutes, and it's not very easy to like keep that much of concentration, and you're just talking for like that a very long time. So that used to be the challenge. And now what they have done, because of COVID, they have reduced the number of stations. Instead of 18, now we have got actually 16 stations. They still have got 2 rest stations, but instead of 18, they have made it 16. So that was one of the change they have done. And another change I would say, now they have got roughly around 6 telephonic consultation. What I mean by
6. That's a big number.
Out of 16, I mean, so 10 stations, you will be getting your patient. I mean, who's actor, you will get the patient inside the cubicle in person. But for 6, when you enter, there is just a telephone. So you're just saying hello, somebody else from the other side will say hello, and you will just talk to him or her on telephone. So just they want to reduce the contacts with the people. So that's why they have introduced this thing. Before that, there used to be maybe maximum 1 telephonic consultation, not more than that.
Yeah.
But now they have made it like 6 telephonic consultation out of 16. I would say this is like 35 to 40% of the exam. So it's a good number, huge number. So no patient is just telephone you are talking. Another thing, so initially before COVID, out of 18, you were supposed to pass 11 stations. So it's not like very tough exam. Some candidates, oh, it's really tough, this and that. I sometimes used to say to them, see, you can afford to fail 7 stations. I mean, if you didn't do well in 1 station or 2 stations, don't feel I'm going to fail the exam. You are supposed to pass only 11. So you're supposed to pass 11, and there used to be an average score, and you need to pass that average score as well. Average score again can be different on different dates. But let me tell you now what is happening after COVID. So out of 16, you have to pass 10 stations and you have to pass the average score. And if you ask me what's the average score, roughly the average score that we have seen, it's like around 100 to 115, I would say. It keeps on varying. It keeps on varying actually. Even sometimes I've seen even 98, 99 as well. And sometimes it's 112, 113. That's happening actually. That's quite normal. Because what happens, I'll tell you, these 16 scenarios, sometimes what happens, maybe one patient is not feeling well, maybe one mannequin is not doing well, so they just cancel that station. So it becomes only 15. So if it is 15, you just have to pass 9, not 10. Many times it has happened. Like maybe
okay. That's interesting.
So they just cancel that station for everyone. So then out of 15, you will be just passing 9, not more than that. So the passing score will be a bit less. So it may be 100, 101. But if there are full 16 scenario, then roughly the passing score may be 110, 112, 113. So again, it keeps on varying, like it keeps on changing. And again, as I said, we have got 2 centers, and both the centers are in Manchester, 3 Hardman Street and 3 Hardman Square. The 3 Hardman Street, it's a new center. Actually, they have got big rooms there. So even I tell like one thing. So you may get some like one patient is there, examiner is there, but you may get some observer as well. So when you enter, you may see 3, 4 people sitting inside. So they are just maybe future
examiner. Yes, as like the pilot, as like the pilots actually. Sometimes in the cockpit is a one extra, 1, 2.
Yeah. True. So I mean, but for candidates, sometimes it gets a bit. I mean,
annoyed. Yeah, I know why so many people actually. Yeah, so
I may not feel comfortable. So yeah,
yes.
So you have to be prepared in a way that even 4 or 5 people are you should be comfortable.
Yeah, I have a question here, Doctor. Actually, for you, actually, how much the physical examination has been changed, because there's a time that people have to examine on the tummy and the things. So, for example, is there any kind of change like that, major changes?
Yes. So, I mean, before COVID, I would say roughly 4 examination mannequins used to come. Again, it's not like given by the GMC, but what the pattern we have noticed, usually 4 examination mannequin used to come. Now, what is happening? 3 examination mannequins are coming. But what is happening? Of course, they don't want you to touch the patient, because of course they don't like that you are, I mean, different doctors are coming and touching the patient. So mostly the examination mannequins are coming, which you can do on the mannequins, like for example blood sampling that can be done on mannequin, cannulation, catheterization, antenatal examination, or even as you mentioned abdominal examination. They have got like abdominal
Yeah, that
mannequin as well, just like
dummy.
half body mannequin, so you will be able
Mhm.
to do on that. Plus they have got nowadays this sim man. It's a big thing now. Sim man is a
Yes.
full body mannequin. So it has got everything. It has got heart, it has got lungs, it has got pulses, it has got eyes
Yeah.
blinking. So all the things are there. So now it is number like 3 out of 16. You can expect 3 examination mannequins, and out of 3 you can expect 1 sim man and 2 examination mannequins, and preferably those examination mannequins which can be done on the mannequin. So if you ask me, I mean, are they asking a joint examination like knee examination, hip examination, elbow examination? My answer is no, because that has to be done on the patient only. So these examinations are
Mm.
coming from last 2 years. Even if you ask me upper limb examination,
Okay.
lower limb examination, they're also not coming from
Right.
last years. We do teach everything, but they're not coming. Why? Because
Yes. Yeah.
candidates give more stress to these things which are coming. Because of COVID, of course, they're not going to ask those
Yeah,
things.
I mean the summary here is those are the some of the examination which is directly related to a lot physical contact. Maybe they are trying to minimize as much as
Yes,
possible.
yes,
Yes,
yes, yes. The
just a
things which can
summary.
be done on mannequin, just we tell the candidates to give more stress to them. So one is sim, and only 2 are left. So two, maybe one, maybe blood sampling or catheterization or antenatal or speculum or testicular hernia. So they have got many which can be done on mannequin.
Many
And,
cases.
and at the end of the day, they're checking our communication skills. So they can
Yeah,
check
very important.
other things as well. Why they need to have more of physical contact here.
Mhm. Yeah, that's fantastic. Yeah,
So
and
PLAB 2, like it's an objective structured clinical exam. So it's an OSCE exam. And courses are happening, like lots of academies are there. Again, we are also doing, but I'm not saying we are the only academy. There are many academies
yeah.
in the UK, and some are doing overseas as well. Like for example, us, we have done courses in many countries, including Bangladesh. We have done 2 courses, and I was
Yeah,
about to do the third one. Then COVID started. Actually,
yeah,
I
unfortunate.
the third time I got the visa on my passport, and I was supposed to travel on 20th or 21st of March.
Yeah, it was very last moment, I guess.
True, true, true. And the main thing in PLAB 2 is like, once you are done with the course, again, you can do the course from whichever academy you feel comfortable with. After doing the course, what we recommend is 4 to 6 weeks or even till 8 weeks, you have to practice in the academy. That is really, really important. That's very, very important. See, most of the academy is now doing face-to-face session. They are doing online sessions as well. So you can do online or you can do face-to-face. Both are absolutely fine. Like for example, if you are doing with us, so you can do online first, and then you don't need to pay again. With the same fees, you can do face-to-face as well. But
Right.
the most important thing in PLAB 2 is you need to give at least 1.5 months after the course. It's about practicing. So you need to practice with each other. You need to make a small group, like 4 or 5 people in a group, and just keep on practicing those scenarios. But this, because this exam is about talking, it's about communication. You have to be more humble. Like for example, like here in the UK, so people, they use these words: kindly, please, sorry, thank you, without any
Mhm.
reason. But in our countries, I would say like, I mean, I don't think so we say these words quite often.
Yeah.
So that's the, like, a culture difference is there. So that is, you will learn when you stay in the UK for a month or more than that. Then you will learn lots of things. You will become more humble. That's why we say like practice at least like more than a month in the academy after your course. That is really, really important. So whatever we have discussed in the course, so you're just practicing with the candidates. And also I always say like when you come to the UK, you will be able to meet the candidates from different countries. I always
That's
tell
good,
candidates,
actually.
don't practice with someone who is from your country. And candidates like, why are you saying this? Because there is a reason
Uh,
behind it. For example, if I say like two Bangladeshi candidates practicing with each other, so what happens? Half of the practice will be in Bangla language.
Local language, yes.
That I don't want. So that's why I say practice with someone like who is not going to understand your language. Maybe practice with Nigerian, practice with Egyptian, practice with Burmese candidates. So they have got their language, you have got your own. So you will be practicing only and only in English. Even after that, discussion will be in English. So exam is in English. So that's why I want them to practice with different country candidates. And also, sometimes what happens, it may be a bit difficult for you to pick the accent from other candidates. It's easy for you to pick the accent of the candidate who's from your country, but from
Same
other
country,
countries, it
yes.
might be a
That's
bit
a big deal.
difficult.
Yes.
So that's why it's really important. So if you're practicing staying in your country, you will not have this leverage. So for that, you have to come to
Mm.
the academy only. So when you come to the academy, you will meet people from different countries, and then you will see you will improve in yourself. That is what is required. That's the difference, like in PLAB 2. It's all about communication, how you're communicating, how facial expression and all those kind of things, how you're smiling. All these things matters actually in PLAB 2.
True. Even that one case, breaking bad news, has a lot of things to do. Yeah. So, huge case on always comes, agitated patient, breaking bad news cases.
This
Yeah.
exam is kind of an acting exam as well. You need to know how to act. So, for
True.
example,
I mean, I say that so often. Yeah.
taking a bad news, sometimes your patient is crying. So you need to manage them like nicely, like offer a glass of water, offer some tissue paper and all. So
True.
that's really important. I always tell the candidates, like maybe you can record yourself and see yourself, what you're doing. I know like you may not find, oh, I'm not good in it. So, but after once, twice, three, four times when you do it, then you will see the improvement in you. It's like a process. So it takes time. So it's always good because exam is expensive. So it's always good if you are give your first attempt with full preparation. Spend like 1.5 months after the course in the academy, and you will see the difference. Mainly like PLAB 2, our aim is like mainly we have to do like clinical skills, like all the examination, mannequins, everything. And mainly in PLAB 2, we're giving more stress to interpersonal skills as well. Why? Let me show you the next slides as well, like how they're marking PLAB 2. So PLAB 2, what kind of questions you might get? Again, I've taken it from the GMC. So let me show you. You are FY2 in rheumatology unit. FY2 is actually intern. In all the scenarios in PLAB 2, you will see you will be a junior doctor. You will be a junior
Yeah.
doctor. So it's not like they're expecting everything in detail from you. They just want some basic things that you should be knowing. Even if you don't know the management in full detail, that is absolutely fine. You just need to know the basics. So what they have given that you are in the rheumatology unit, you are told that your patient, you have got a patient who is James and his age is 45. He was referred by the GP with the pain in the right big toe. So when you see right big toe pain 45, I think some differentials comes in your mind. You are not given any other information. So go in, talk to the patient and manage the patient. So these kinds of questions you might get. So you'll get a patient, age, name, and what's the presenting complaint. So you just need to go there, explore his complaint, rule out some differentials, some risk factors, and give the management plan. In PLAB 2, they are going to mark you on 3 domains. Number 1 is data gathering. So how you're gathering your data. So that's your history taking skills. Then your management skills. Each station is for 12 marks actually. So they have got 4 marks for data gathering. They have got 4 marks for your management. And these 4 marks are for interpersonal skills. What does it mean? How you are communicating. So if the way you are talking, if you are able to make your patient comfortable, if you are empathetic enough, then only you get these marks. And also one very important thing is in PLAB 2, it's not about you giving all the information to the patient. The most important thing is listening. Because in our countries, the culture is different. Maybe in
Yeah.
OPD, you are seeing maybe more than 100 patients. So of course, you can't spend like more than a minute or two with one patient. But here in the UK, the quality matters. And you need to listen what he's saying. That's really important here. So it's going to be patient is just talking. And your job is to listen. You just be a very active listener. Okay.
Yeah. Also, some of the, additional things like, when I also tutoring them clinical, there's another word we use, are you with me? I mean, when I'm explaining that,
Yeah.
just to make sure that, the person is connected with me. So there's a lot of, small things out there, that others also need to get familiar with, especially while they're practicing. Yeah.
But it's like when you give the information, you give in bits and pieces and check if patient understood it or not.
Yeah.
When we teach, we used to say like after saying 3 lines in the management, take a deep breath. Why I say this, take a is pause, let the patient digest the information. Otherwise, if you're
Yeah.
all the information in one go, that is of no use. You need to make
Mm.
sure your patient is retaining the thing, patient is able to understand what you're saying. So all these things are important. So out of 12, if you see, out of 12, I mean, 33% of marks is only on interpersonal skills, how you're talking. 4 marks for data gathering, 4 marks for your clinical management. So that's how it works in PLAB 2. So the question actually, I'll just, as I showed you the sample question for PLAB 1, let me just properly show the sample question for PLAB 2 as well. They usually divide all the questions in 5 headings, and there's a reason behind it. It becomes easy for you to read the question, because for reading the question in the exam, you get now 1.5 minutes. 8 minutes you get inside the cubicle with the patient, you just take history, management and everything, and 1.5 minutes you get to read the question. So it would be really good if they divide things. So usually the question is given like this: where you are FY2 or foundation year 2 doctor in rheumatology unit. I just use the same question. So it becomes very important, because if you are in rheumatology unit, if you are in GP, if you are in A&E, if you are in medicine, things will be different. Things will be different because in A&E, you want to do the emergency treatment. In GP, you can do only basic treatment. In psychiatry, for example, a patient who has committed suicide and coming to you in the A&E, your job is to save the life of the patient. However, if the same psychiatric patient is there and you are FY2 in psychiatry, then you will go and take proper psychiatric history. So you need to know where you are. You are in A&E, you are in psychiatry. So the way you take history will be different. The second domain would be who the patient is. Who the patient is, like, they will give you the information like patient is James Horton, age 45, referred to you because of the pain in the right big toe. So this information will give you some idea. Idea meaning I feel it may be gout as well, right big toe. It might be maybe something like cellulitis or something like that. So
Yeah.
they'll be looking into like different directions. Other information you have about the patient. Sometimes, not always, sometimes they give you some extra information. Sometimes they just write none.
Yes.
But sometimes in this scenario, for example, they might give you that patient is drinking 1 pint of beer daily. That is important because beer is a very
risk factor for this gout case.
Sometimes they might say patient is hypertensive and taking thiazide. That is also important.
Yes.
They just want to give some extra information. Everything what they write in the question is important. And then they just tell you like what you must do. So what you must do is you must assess the patient and manage the patient. Sometimes they give management with the patient, that you need to discuss the management with the patient. Sometimes they say discuss the management with the examiner. So you discuss the management with the examiner, meaning read the task properly and just go accordingly. And then sometimes they have got a spatial note as well. Sometimes they say, oh, patient is angry, patient is concerned. Sometimes they say consent has not been taken from the patient, because sometimes you're not talking to the patient, you're talking to the relative. So you have to be very careful if you have got the consent or not. So that you might see in spatial note. So all the questions in PLAB 2, like you have got 16 scenario, all 16 scenario will be divided like this in these 5 headings. And then you just read it for 1.5 minutes, you go inside, you talk to the patient and make sure you are able to manage everything in those 8 minutes. So that's how it works.
Yeah, and it's a good format actually. Even next time, whenever someone see one question, in that case, they can immediately split that into section. That okay, here will be this informations actually. So one thing I want to highlight, since I've been also tutoring clinical. So there's another thing. Often the candidates make mistake. They don't read that particular part. What you must do. That, this is one of the part, because they have always in their mind that, maybe a case I always have to take the history. So you need to see very carefully that, is it a history taking? Is it a something in they're asking about the management or things like that. So, so this is something, very important actually to understand,
sometimes like they just keep, sometimes they play with the mind. They're like, sometimes they're giving the management with the patient, and maybe the next time they give the management with the examiner. So it's you who's gonna.
Yeah, true. Yeah, very important. Very tricky. Yes.
With the patient, they are not going to stop you. They will just let you do whatever you are doing.
Yes.
It's you who needs to know, like, if it is with the patient or with the examiner, and you need to do
exactly. I mean, these small things are very important. I mean, your presence of mind, they also want to check, like, how alert you are in the example. This is also a part of exam. Like, you don't crack down under pressure. That, you need to know your position. Some people, while telling that, junior doctor, like, you also need to see your position actually, which is usually mentioned actually. So because sometimes you guys just practice it. Okay, hi, I'm Sharir, one of the junior doctor of. So because you always practice like that, but if your position is GP sometimes, so you need to mention that one sometimes. So that if you're always practicing that you're a junior doctor, so actually it might be split out that misplacing the word. Yeah.
So like everything will be changed. For example, if you are in the emergency A&E, or if you are in, like, say, psych, I always give this example, like a patient committed suicide and now she's coming to the A&E. A lot of candidates, they keep on asking, oh, why you did that, this and that. See, that is not important here. You are in the A&E, she has committed suicide. What's your job? Save the life of the patient. So you need to know, like, what exactly she has taken, how many tablets or so she has taken. Just get the history quick and save the life of the patient. That is important. But if it is psychiatry, you are in psychiatry. So in that case, what does it mean? Medical management has been done for the patient. You don't need to go in the medical history. Now you can ask psychiatric history, whatever you want to ask in psychiatric history. So that's why reading the question is an art. You have to read the question very carefully. And everything is, like, given in the question. So where you are, what is your job here, patient is a male or female, and what's the presenting complaint, some extra information is there. Special note is very important. If you're talking to the relative, you need to know how much information I can give to the relative. Do I have got consent? No. Yes. So all these things are really, really important.
Okay. Fantastic.
Right. So fees, I mean, for PLAB 1 and PLAB 2, it again keeps on changing. But recent, if I tell you, PLAB 1, it's £240, and for PLAB 2, it's £879. It was £840, but recently they have increased to £879. I think on 1st April 2021 onwards, they have increased it. And I've heard they're going to increase it to, like, even more. I don't know where it will go.
Yeah, so
it's 240 and 879. So again, you can see, like,
exam is in demand, so they can increase anytime. So
and for PLAB 2, they used to have only one center. Now they have got two in Manchester. The reason is only one, because the demand is increasing, as simple as that. And of course, they're earning money because the exam is like £879. So that's the thing.
There's one doctor was asking that, is why is that happens that, UK always need more doctors, or we can see the demand is always, being there. So usually, how I answer that one is like, see, compared to our subcontinent countries, like number of, person per number of doctor, this is very different. Actually, like, they don't see a patient in 1 to 2 minutes or 3 minutes actually. So this is one of the things, and there's a lot of things. Doctor, there's a different positions. Junior doctor, they work under the supervisor, so their work, so you are also doing at the same time. So there's a lot of things, a lot of positions out there. So you need a lot of doctors in different positions actually, to be honest. But you know better actually, how this works.
Like in our countries, like maybe like in 1 hour OPD, we are seeing like 50 patients. So, but it's not the case here. For example, if I tell you, if you are working in acute medical unit, which is like after A&E, we admit the patient in acute medical unit. So you are doing full history, full examination, everything you are doing. And you can spend more than 1 hour with one patient. So if you are doing a job of 8 hours, if you are seeing 5-6 patients, that's more than enough. I mean, in our countries, you can't think of
no. You'll get a notice from the higher authorities.
And I was in respiratory wards. If I tell you, like, we were having 3 consultants, we were having 2 registrars, we were having 4 SHOs, and we were having 2 or 3 trainees, FY2s. So see how many doctors in one ward, and we were looking for only 35 patients. So see like the range. Three consultant,
Wow.
2 registrar, 4 SHOs, and 2 to 3 FY2s we were having in one respiratory ward only, where we were seeing total
Then only respiratory, yeah.
respiratory. But of course, like we used to go to other wards just to see our patient, like cardiac patient needs respiratory assessment. We were going to their ward as well, but our ward 35 capacity. And if you see like 10 doctors are there. So
True.
how it works here. So that's why the requirement of the doctor is increasing, of course.
High, and I think it's still quite high because the reason behind that one is because it's the 2020, that's the year. I mean, they couldn't recruit as it's required actually. So there's now, this is another thing. I mean, they are, and and in very fast way, they cannot recruit, I mean, even till date, because I mean, still the COVID is out there. So there's a lot of screening process and the thing. So that's the reason. I mean, a lot of positions and things is still out there, but so if you finish PLAB quickly, I think that's the best chances will come actually, because once you pass PLAB 2, you can always, after getting the GMC registration, you can always apply for the. Now, one thing I will just ask you here, because a lot of doctors actually, taking some type of steps, but to be honest, most of them are a bit financially stable. As that one is like, many of them are directly taking a subject in UK for, say, in any of the universities. There's a lot of universities out there. Some are expensive, some are reasonable actually. So if someone just want to get out, and because of the the COVID being hampering their life, and also their plan, everyone has a plan, right? That I have to finish in 1.5 years, then I'll get married, right? Different people have different plans, because we get to talk a lot of candidates all the time actually. So so is that the right, I mean, in some cases, idea that that switching, taking a risk, the low budget university and joining and finish up these PLAB things quickly? Now, the question that comes, like staying there, appearing in PLAB is not a big problem. They can appear in PLAB 1, they can appear in PLAB 2 very easily. They can pass it. They also can get the GMC registration. Just an extra tip from my side here that maybe they can finish their EPIC verification before they go, because that paper goes to university. But sometimes it might take some time. So if you can do that before going to those universities and just do your EPIC verification, actually, that'll be a tip here. But now, after finishing the GMC, because for GMC, you will be also needed those EPIC verification paper and every so on things already. Is it possible staying there in that university and securing a job in NHS? Is that possible after finishing, maybe taking a 1-year course or 1.5-year course? Is that possible, like directly joining NHS, staying in the UK at the same time?
Yeah, definitely. Actually, that is also like one of the good options. Like, of course, like whenever you're joining into a course, you may have to pay like 8 to 10,000 pounds. But there are some good things. First of all, your visa will be sorted, because many candidates, they do face the problem when they are applying for the visa for PLAB 2. So they are struggling with and all. So visa is sorted. Number 2 is like for PLAB 1, of course, you can give in your country, but the seats are limited. But in the UK, there are more seats, and it's happening like every 3 months. The PLAB 1 is.
I mean, whenever you are ready, I mean, you can just book in like a 1.5 month or 2 month prior. I mean, you can just imagine that here people are half of my mobile messages full of, doctor, is there any update? You are getting a date. Yeah, so that problem will not be there, I guess.
So, I mean, these things can be sorted if you are already in the UK. And also, like PLAB 2, I would say, like when you are staying in the UK, you will be learning culture. That is really important. So
very important.
In the UK, clearing PLAB 2 becomes easy for you. You understand their mentality, you understand their culture, you are able to pick their accent very easily. So things becomes very easy for you when you're appearing for your PLAB 2, because you're already staying in the UK, maybe say for last 6 to 8 months. So it becomes easy for you, like to do all these kind of things. So that is definitely an option, because of COVID, even things are getting difficult in terms of securing the visas and all. because red list this. So
yes, it's like a security, So some of the candidates I told that, see, if you can afford, I mean, you can always take your chance actually, because, in another way, let's just take it in that way that, see, if you take this risk and maybe you are putting this, £8,000, and let's just say because of taking this decision, you able to finish your plan more early than, considering you're staying in your own country. Now,
Right.
if you're finishing, at least, 6 months, 8 months, or a year early, because, you never know, how many months you have to start there. So if you join early NHS and you start earning there, so in a way, just, talking like economics, Yes.
In a month, you will be earning, say roughly around maybe 2.5 to 3,000 pounds.
3,000. I mean, depends on, working more in the shifts or Saturdays or, the locums. Yeah.
So I mean, in like say 2 to 3 months, you have recovered what you have
recovered. Yes, exactly. Actually, and those are hardworking. You can recover, in fact, more actually. So a lot of doctors can, they don't take breaks. They keep working in the Saturday, Sunday. We are from a lot of candidates.
We can work 7 days a week. For example, British is 4
to
5 days a week, but we can work 7 days a week. That's not a problem for us.
Yeah. So initially, if you have that mindset, no, I have to just, bring out all those I have to spend. Yeah. So in that case, it can be an option. So, there's always, so the summary here is always there been an option. Like if you want to earn a little bit more extra, do some extra shift, especially in the, weekends actually, though their own doctors, usually they don't want to work, or even those are families, like just to point it out, like those are families, kids, they don't want to work especially unless they have to, some cases. So, so you'll have those, once they have that confidence in you that, you are safe, with this, ER and, some of the relevant things, they will give you more opportunities,
Yeah, whenever you're signing the contract, usually they say you have to work with us for 40 to 48 hours maximum actually per week. That's the contract. But 40 hours, it can be done easily like in 5 days. 8 hours. So you still with Saturday or Sunday. So maybe like Sunday you enjoy, but Saturday you can do the.
Yes, that's most people do that. At least one day break, you also have household work. But I think that extra day they, spend. I know an interesting thing. I was not sure about India, but in Bangladesh, we have actually, 6 working days. Especially for medical persons. I'm not very sure. I forgot that one. Some Indian students say that. So, how was in India that one? I forgot that one actually.
India also like it's a 6 days.
Six. Yeah. So we are habituated with that thing, right? That working like 6 days actually. So that extra day you can do that shift actually, and you can earn. Yes, and some of the special occasions, like example. Christmas, and it's like I think the payment is structure is different.
Yeah, the payment is double actually during the Christmas time, because Britishers, they are not going to work. So when you're working,
no way.
Pay, so that's actually something good. And also, like for example, if you're working 8 to 5, so sometimes there is some requirement of the doctors, and you can like work from 5 p.m. to 9 p.m. as well, like extra 4 hours. So many hospitals, they do provide that facilities as well. So your normal shift is from 8 to 4 or 8 to 5, but they want doctors in the evening as well. So maybe you can extend the same duty for next 4 hours as well, and that will be counted as extra hours. So a lot of doctors, they do that as well. So, there is always an option. So one day you can keep to yourself, but one day definitely you can work.
Yes. So I'll just get back to the basic, guys. Start with the English test. That's yeah. So that's one of the thing actually. Many question comes. As I said, the messenger. Sometimes I just lock the phone actually, because the same thing. Without finishing English test, if you just keep texting us. It's nothing more we can do for you, to be honest. We can just say one to good words and things like that, but thing happens, the more question comes, actually those haven't finished the English test actually. So since both of us working in kind of similar fields, so that's why we had this seminar to work on some of these common questions. So guys, it's ideal. It's the most important early thing you can do is you start your English test today, actually, so and start with a mock test, actually. And when you want anything which is a nearby center, just go and take a mock test, assess yourself. You'll have some confidence, actually. Some people think, okay, when exam will come, then only just before exam. But that way it will never come. You should book a date, actually, like a 2 months or 3 months, depends on your caliber. Actually, you should book a date, actually, and then you start taking preparation. Your body will work automatically according to that. Our human body is made in different way. So even we go to war, right? Actually, and in our body adjusted according to that. Actually, the same thing. Even if you take an English test, 2 month or 3 month with the hand. So eventually, you will be ready by the time, I believe.
And also, like if you are, if you are in your final year intern, so just start practicing. Start doing your English exam preparation. So when you are done,
it's more easy.
You will be able to do your PLAB 1 and PLAB 2. So make sure you are done with your English exam in your intern. So that is also one of the options that you can take if you have already planned to come to the UK.
True.
Yeah. Right. So let's say a few things about the visas as well. So there is one option. You can take a small course here in the UK. So they will be able to sponsor your visa. And when you are here in the UK, you can give your PLAB 1 and PLAB 2. Otherwise, if you are just coming here for PLAB 2 exam, so when candidates applying for the visa, what are the things they definitely need to consider? So of course, for mandatory documents, of course, valid passport and your PLAB 2 GMC confirmation. So when you have booked the exam, maybe 3 months from now, so they will be sending you a confirmation letter. So make sure you are putting that in your application. That's really, really important. One thing, whenever you are applying for the visa, they are always looking for a few things. Number one is they're looking for, are you definitely gonna come back? This is the mentality of the visa officer. So for example, if you are married, it is always a good idea you put your marriage certificate. So that's very important. And for example, if you're doing a job in your country, so make sure you are putting your NOC, non-objection certificate from your hospital. So these are like very important documents which will prove that definitely I'm going to come back after doing my PLAB 2. So that is something you can do. Okay, what are the documents that we will be needing when you're applying for the visa? So you need to make a proper cover letter. So if you make a proper cover letter, visa officer is going to read your cover letter. If it's written in a very detailed way and a very nice way, they don't look for much of the documents. So please work hard on your cover letter. Other thing is, what are the support like financial thing? Because when you are staying in the UK, say for 2 months, so you need to show that I'm financially stable. So you need to show how I'm gonna stay, where I'm gonna stay, and staying in the UK is gonna cost. So maybe say 500 to 600 pounds per month. That's just for the stay. Then you're gonna eat things, so maybe 200 to 300 for your eating things and all, and transport as well. So roughly you can say 1,000 pounds for 1 month you have to have. Plus your travel in the sense from Bangladesh to the UK. So maybe like 700-800 pounds for that as well. And if you're staying, for example, say 2 months, it's always good if you have got roughly maybe 5,000 to 7,000 pounds in your account. So it's not like it should be in your account. You can have that money maybe on your father's or your mother's or any sponsor who's going to sponsor you in their account. That should be fine. That's not a problem. But if you are putting money maybe in your father's or mother's account, so maybe you can do one thing. You can put an affidavit declaring the financial sponsorship that yes, my father is sponsoring me, yes, my mother is sponsoring me, yes, my brother is sponsoring me, and the money is there in their account. That is absolutely fine. But another thing, usually they want you to put the bank statements. So bank statement, if you are having money in your account, so your bank statement, or if it is your mother's or father's or brother's account, so of course their bank statement. Usually they ask for a 3 months bank statement. You need to be very careful in those 3 months. You're not having any other kind of transaction. First of all, try to refrain from the cash transactions. Don't put any cash in that account, which will reflect in your bank statement, because they might be thinking it's an illegal cash that you have put. And that might be the reason of your rejection of the visa. So be very careful. So for example, if you're working and you are planning to apply for the visa in next 6 months or so, so whatever salary is coming, let it be there in your account and try not to use it from there. Or even if you're using it, use it, it's fine, but maybe like swiping the card and all, try to use more of like bank transaction, not the cash transaction. That is something very, very important, because they don't want any big transaction like in one go. So they will be thinking you have done this only to get the visa. So it's a very important thing. I've seen many rejection of the visas because of this thing. So bank statement,
Yes.
3 months, you have to be ready for that. And your income, you have to show, of course, your salary letter. So you can take this salary letter maybe from your hospital. That is important, because sometime whatever, for example, you said my salary is this much, but in your account or in your bank statement it not be this
Mm,
much, because lots of income tax
yes.
and all, it's been cut. So it may become very difficult for the visa officer to understand, because he's saying my salary is 1,000 pound, but on the bank statement it is showing only 800 pounds. So there is something, some problem. So make sure you are writing all these things clearly in your cover letter, that this is how and why I'm getting 800 in my account. Or take one letter from your hospital that this my salary is this much. So that is also quite helpful. So that is really, really important. Just
I'd like to add something here, actually. Yeah, sorry for, yeah.
no.
So I'd like to add one thing here, because since I'm been a frequent flyer in different
Mhm.
countries, the same as Dr. Ankur. So one very important thing, but we have noticed, like, see, I mean, all these statement things has, take it very seriously, because you gone through everything correctly, but just out of just overexcitement and the things, if you just change in these numbers, you are thinking these are not that serious thing, but for a visa officer it's very serious thing. Also a lot of other information that comes when you are applying, that if you're a frequent flyer, it's a little different. That means, like, say, so for example, for me, if I go to UK, I've visited many of the big countries in recent times, so it's become a little easy for them. So this is another point you need to be considered and very serious about those numbers. One more thing, many doctors in these countries, especially in early days, they don't have that kind of income. And
Mhm.
even though they have that income, not that very serious about the income tax. They thought, okay, it's very early life, and making these documents and the
Mhm.
papers, this might not be that serious. But let me tell you one thing: income tax is always being a very strong document if you have it. Actually,
Mhm.
it shows that you are very clear on this thing.
Mhm.
So your numbers, if you have income tax, that's good. If you're working, actually, if you're working and earning, if you're not earning, then it's a different thing. Then the guardian sponsorship, those things are coming. So please choose. This is just a small tip here, that if you also can provide the income tax certificate, it's
Yeah.
always very good, especially overseas traveling. And if you're
Mhm.
going there for longer time, it's very useful, actually. Yes, Doctor, please continue. Thank you.
Yeah. So actually, all these documents actually they make you more credible. They feel like, yes, this person is
Yes.
like credible, so they can trust. So that's why actually whatever you are putting in your cover letter, whatever documents, for example, you are putting my salary is 1,000 pounds. So you need to prove it by showing some documents, maybe bank statement or maybe a letter from the hospital. So it's not like I'm saying my salary is 1,000 pounds. Show it maybe with the letter from the hospital or from bank statement. That is what they want actually. That becomes easy for the visa officer to understand things, and they don't have to look for a very long time, and they just grant you the visa. Also you can put like evidence of home address, maybe like some electricity bill or so, for example. So that is also quite interesting. So you can like some electricity bill or something you can attach in your visa letter. And you can also show the accommodation that you have booked in the UK. So maybe any hotel accommodation or academy accommodation whatsoever. Also, what can be done if you are not sure where you are going to stay when you're applying for the visa. So even like from booking.com, you can just book the hotel, and later on, once you get the visa, you can cancel it. That's not a problem, and you're not paying anything. A lot of candidates are doing that thing as well, which is absolutely fine. It's not illegal. And also if there is any like evidence like a family ties in your home country whatsoever, your family is like your father mother doing, so you can just put that thing as well. Or if anyone is staying in the UK, so maybe you can put their documents as well. So that is also like quite credible. And many people ask, should I mention the academy in my cover letter? It's like a lot of time I get this question from
Hmm.
candidates all over the world, like should I mention the academy? The one thing is academies, they are not your sponsors. We are not authorized to sponsor visas to anyone. The sponsors, I mean, who is your sponsor when you're coming for PLAB visa is your GMC, because you have got your PLAB 2 confirmation. So you need to write academy in a very subtle way. You can put the academy document. We can, for example, we can provide you with the document, that you can put in your supporting documents. However, when you're writing things in your cover letter, be very careful. You have to write like, for example, I'm going to come to the UK maybe 2 months prior to my exam. What is the reason behind it? I'll be doing quarantine. That is one. Secondly is I have to get accustomed to the weather condition here in the UK. Third, I'll be preparing for the PLAB 2 with the help of maybe my friends, those who are already working in the UK according to the PLAB 2 blueprint. Also, I'll be attending some preparatory courses as well to get myself into like in the system, like how things are done in PLAB 2. So write just this much. I have not mentioned, for example, Aspire in the cover letter. However, put the supporting document that we are going to provide. Why we get cancelled because of academy? Some candidates, they write academy in a like proper way, like
they're I mean, academy is taking them directly, so yes.
Like they're writing, I'm going to attend Aspire Education PLAB 2 course, which is of 12 days. That's why I'm going early to the UK.
No, you are going for a PLAB 2 exam actually,
yes.
like and especially GMC is the thing, so they have to,
yeah. So like the way you write things, that is going to help you. So I'm going to go there only for my PLAB 2 exam. Why I'm going early? For quarantine purpose, for getting accustomed to the weather condition, because it's completely opposite the way it's there in my country.
Yeah.
And also need to practice with my friends, maybe those are already working in the NHS according to the PLAB 2 blueprint. So that's really the thing. And I'm going to do some like some preparatory course as well when I'm in the UK. That is it. Don't write Aspire Academy or any other academy. But it is always good to put their document. So like any academy you're attending, or if you're attending our academy, we can definitely provide you with one of the document where all the details of the academies are there. So you can definitely put that as your additional document. So
I would like to just, sorry for interruption, one thing that because we are talking about the document things, about the academic document, which has to be put in some smart way. One more thing, if there is a relative living in UK, so that person can be also sponsored. Is it?
Yeah.
Like,
so the thing is, they just want to see if this, we can trust this person who has applied for the visa. So
yeah,
my brother is staying there in the UK, and this is his home address and this is his passport number. So, they have got another thing to confirm. Yes, he's a legit person. I can trust this person. So there are high chances of getting the visa.
Now, here, one of the question that often comes, like, how close that person has to be. If it's like not everyone's own brother and the sister, if it's a cousin brother and the sisters, they are living. As far as I know, it's applicable. Actually, just want to confirm from you that anyone who is a
that is absolutely fine. Even it's not like real brother, even if it's a cousin brother, that is fine. That is fine. It's just like we are trying to make our application stronger. That is it. So we are definitely going to put all these documents. But yes, if you have got any family ties in the UK, or just put those documents. That's going to help you, of course. And also, that's very important. I know many people, they don't take these things very seriously. Marriage certificate and the NOC from the hospital if you're working.
Exactly.
These
very important.
documents are very important, that yes, after giving my exam, I am definitely going to come back to my home country. So these two are very, very important. So if you are married, so make sure you are attaching marriage certificate. And if you are working, just put the NOC certificate from your hospital. All these two documents are very essential. And be very careful. It has to be very clear. The bank statement, whatever you are earning, it has to be very clear. And make sure no cash transaction in at least last 3 months. So that is really, really, really important. Right. And also, I will tell you, recently, one of my friend actually from India, he applied for the visa and his visa got rejected. The reason was he was getting salary once in 3 months, not every month, because of COVID. And they said, no, you said your salary is this much, but your bank statement is showing something else. And then, he's going to apply again with the explanation, no, it's the same. It's just like they're crediting my salary maybe once in 3 months. These small things can lead to the rejection of the visa. And, it's like mental pressure and then a lot of things after rejection. So make sure when you're applying with with every single proper document.
Very nice points, actually.
And right now, if you see COVID-19 changes, if you are able to travel to the UK or not. So there are 3 lists they have made actually. One is red list, one is amber, and one is green list. So they have got 3 lists actually, and they are reviewing their things every 3 weeks actually. Every 3 weeks, the UK government, they are making changes. So they are putting some countries to amber, some countries to red or green. If you are from green country, it's fine. You can come to the UK. There are no restrictions. That's absolutely fine. If you are from the red list, actually, I think Bangladesh actually at the moment is in the red list.
Red list.
You actually cannot travel to the UK. If you already have the visa, you can. However, the new visas, I'm talking about the tourist visa or PLAB 2 visa, they are not giving. If you are from red list countries, they are not giving any tourist visas. However, if you're applying for tier 2 or business visas and all, they are still giving those visas. That is fine. Otherwise, if you already have the visa, you can travel to the UK. You can travel to the UK, but you have to do hotel quarantine. And
the fixed quarantine, I guess.
Yeah, fixed quarantine, and they are gonna give you the hotel. So they will give you the hotel, and you have to stay only in that hotel only, and it is gonna be expensive. For one person, it is £2,200 for 10 days. It's really expensive. It is expensive. So, but there are a lot of people, they're doing another thing, because when you are there in the UK, they ask you one thing: where were you in last 10 days? This is the question they ask. If you were in some other country which is in amber list, then you don't have to do hotel quarantine. You can do home quarantine as well. So for example, like from Bangladesh, maybe you have traveled to Dubai. Dubai is an amber list. Stay in Dubai for 10 days. And then you come to the UK. Now you are not coming to the UK from Bangladesh. You are coming to the UK from Dubai. So you are coming from amber list. Then you can do home quarantine. You don't have to do hotel quarantine. So that is a thing that a lot of people are doing. But again, you have to have the visa to do this thing. If you don't have the visa, then definitely you cannot get the tourist visa at the moment if you are in red list country. So this is
well
like
said.
Yeah, so I mean, I think the next list, Pakistan and Bangladesh, will be out from the red list, because last one India was out, and now India is in amber list. But hopefully the next one.
Today's rate is very less in Bangladesh. I mean, it's getting just the downfall is just keep happening now. Actually, maybe by a month, if everything goes well, let's see. I mean,
Yeah, this is what we are hoping. I think in the next list, Bangladesh will be out from the red list and will enter into the amber list. Then you can apply and get.
Also, just to add one thing here, all this thing doctor is mentioning here, those are planning to fly to UK has to be vaccinated with 2 doses of those. I mean, verified vaccines. Like it can be Pfizer, it can be that the Oxford one, and it can be the Moderna. I mean that the big short vaccines actually.
Yes, but they have made like a very interesting rule. I'll tell you, like, so for example, okay, so if you are coming from the amber list, then you have to quarantine, which are like lots of hotels, they are doing the quarantine. Even if you are going to stay with your relative or so, you can do the quarantine there as well. That is absolutely fine. And you have to do a COVID testing. You have to do COVID test day two COVID test, and you have to do a day 8 COVID test. These 2 COVID tests you have to do, because you are doing quarantine for 10 days. However, if you want to reduce this 10 days quarantine to 5 days, you can do an additional test to release on day 5 as well. So if you do this test on day 5, and if it is negative, you can come out of quarantine only after 5 days as well. So that is there for these amber list countries as well. Another very interesting thing, even if you got Pfizer, or if you got maybe Moderna or AstraZeneca or Covishield, they are approved by the UK. But very interesting thing is, if you got Pfizer, for example, in Bangladesh, or if you got Pfizer from India and they are in amber list and you are coming to the UK, you still have to quarantine. You can do home quarantine, but you have to quarantine. However, it's quite interesting. I have got Pfizer from the UK. If I go to India and come back, I don't have to quarantine, even for a day. So for me, for a person, those who got these vaccines from the UK, from Europe and USA, only these 3 countries. And if you got Pfizer, AstraZeneca, Covishield, Moderna, you don't have to quarantine for a single day. I mean, that's interesting. I mean, you're getting Pfizer in Bangladesh, for example, then why you have to quarantine? But according to their rules, you have to. But that can be like, say, home quarantine. I mean, if you are from amber list. So that's
Yeah,
quite interesting. I mean,
very. I mean, this is a lot of tricks with the vaccines, actually. Yes. Also, just to add one thing for the viewers, today, we are doing the session, and this is 5th of the September. So, if anyone watches this particular thing a little later, maybe, and maybe after a month, if you're watching in November, things like that, please do check the list of your country. Currently, Bangladesh Bangladesh is red listed, Pakistan red listed, India, as you mentioned, just got out from the red list actually. But yeah, so you always need to check that particular list, and your border and immigration. It's very important to also check actually what are the rules to go out from the country. Also, there are a lot of rules to get into a country. What if you were going through a country? This is another thing applicable. Is your flight is direct? Or is your flight is, the via Dubai and things like that? If it's via Dubai, how many days in Dubai? So all these things are, I think, included here as far as I know.
Yeah, and also like it's always good, just refer the gov.uk website. So they have got all the updates, they daily update their stuff. And so just keep on checking this, whatever the rules are changing. And just follow those rules. And of course, like I think Dr. Ahmed also mentioned like about the accommodation. So I know when candidates are coming for PLAB 2 accommodation, they are like where I should be staying. Should I mean, maybe they book an accommodation which is not good, and later on they regret it. And maybe the accommodation is not there. Somebody just maybe
safety concern also for a lot of female doctors. They go first time from their life actually, so without parents. So it might be a concern for them in some cases actually.
And also, it's always a good idea when you are attending, like for example, PLAB 2 course. It's always good to stay nearby the academy. So, for example, you can come daily to the academy to practice, because even if you get accommodation cheaper, which is far from the academy, is of no use, because traveling in the UK is expensive.
Yeah, again, $10, $20. Yeah,
it's quite expensive. I mean, if you have to enter into bus or tram, it's like £2 is gone, like just by tapping your card. So it's quite expensive. So you need to like consider all these factors. So yes, we do have accommodation. If if you're coming here for PLAB 2, and if you're joining our academy, we have got the accommodation. We have got like separate accommodation for male doctors, for female doctors, and even if there are couples, like even we can provide accommodation to the couples as well. And all the facilities are there in the accommodation in regards to like say washing their clothes or iron them, or all these kinds of facilities are there. Kitchen is there. They can prepare their own food, and also maybe prepare food for one day and then they can consume it for next 1 or 2 days, because their main aim is to prepare for PLAB 2. But eating, like if they can prepare something in the accommodation, so it becomes cheaper for them. I mean, they don't have to buy food all the times from outside. So all these things can be done. And like academy accommodation is a good idea, I would say, because it's nearby the academy. And of course, it's legit. They can trust that thing because they have trusted the academy, so they can trust the accommodation as well. So all these things are, good. And some academies are like, they provide some mannequins also in the accommodation itself. So maybe in the evening, night, you feel like studying, you can like use the mannequins in the accommodation facilities as well. So that's, and also
as like a kind of med school days, those who are living in the the hostel in the med school, it's just coming out and practice in the night time, and also those scopes and things out there. Also like to ask, like that as per accommodation is also in Manchester, right? I mean,
so
very near to academy.
Yes. So we got like now 5 accommodation we have got, like some are for male, some are for female, some are like joint, like couples and all. So we have got different, we have got double rooms, we have got single rooms, everything. Like we have got attached washrooms as well. So it depends what are your requirements. So we have got like
I mean, in UK, this is a very common thing. If anyone is even going to any universities also has a lot of accommodations.
Yes.
I mean, just telling that, but if you're taking a room which has that attached bath, so definitely it's going to cost a little bit more. But if you're using a shared toilet, you're a male person, you don't bother much in using a sharing toilet. So, I mean, in that case, you can, those could be more cheaper actually. So as Dr. mentioned, like all types of particular things are available there.
And also, when you are in the accommodation, so you'll be having candidates from our academy only. So you can practice with them also in the accommodation itself. It's not like always you have to come to the academy only. So academies, for example, open from 10 to 7. So after 7, if you want to practice, so you just go to the accommodation and practice. Still, you can practice in the accommodation. So that's
the main job. Yeah, like, before exam. Yeah, most important job.
Yeah, when you're in the UK, your aim is PLAB. Your aim is PLAB. So you need to think, and you have to be in PLAB to think only like day, night. So
Yeah.
in the day, you are in the academy. In the evening, I mean, of course, you can have like proper dinner or so. Then maybe 1 2 hours again, you can practice in the academy, I mean, in the accommodation as well. So that is really, really like crucial, I would say. So that's quite interesting. So summary, like if we do, I think we have taken a lot of your time. So summary is like, first of all, English exam. So IELTS or OET, it is entirely up to you which one you want to take. And we have mentioned like OET is actually easier if we say in comparison to IELTS, but again, it is your choice, whichever exam you want to do. After that, you can make your account on the GMC, create an account on GMC and book your PLAB 1. Book your PLAB 1 and then prepare for PLAB 1, give your PLAB 1. You can give PLAB 1 in the UK, you can give outside the UK as well, and you can give in Bangladesh as well. Right. And after you're done with your PLAB 1, then you have to go for PLAB 2. So PLAB 2 is only and only in the UK, only in the UK and only in Manchester. They have got 2 centers actually. So preparation for PLAB 2 actually can be done when you are in Bangladesh, for example. So maybe you can join first online course, and then when you come to the UK, you can attend again in person. It's not like you are paying again and again, just in one piece, first online, and then just before your exam, when you're in the UK, attend in person as well, then practice. That's really important. So whenever you're coming to the UK, make sure you are having at least 2 months before your exam. So maybe 15 days coaching and then 1.5 months you are spending there for practicing only. That is really, really important. And some extra thing for COVID, I'll tell you, like if you are coming from amber list country, so PCR test you have to do on day 2 and day 8. This is mandatory actually. It is mandatory. But if you want to come out early from 10 days quarantine, you can do an extra test on day 5, on extra day 5. And if it is negative, you can come out. I know the strange thing is even if your day 5 is negative, you have come out of quarantine, still you have to do this day 8. So actually you will be booking these tests before you come to the UK. So on the government site only, these can be booked. So you will get the courier and everything in your house only. So you can just do the swab and do the courier. So all the things are like automatically done. You don't need to worry about it. So day 2, day 8 mandatory, but day 5 is optional. It's only if you want to come out of quarantine early. Because if you have got less time, you got late visa and you just want to utilize every single day.
Yeah, a lot of people are businessmen too, actually. They are also traveling for some other purpose. Yeah. So it depends actually. I mean, students they don't have to bother. They have a hotel room and thing. Your job is to study. So for them it's okay because they're already paying for 10 days. So
there are some candidates, those who are like very like maybe just 2 weeks they have got just for preparation. So they just feel
going out early and start preparing early. Yeah.
They can spend extra 5 days in the academy to practice on the mannequins, and they feel like much prepared. So many candidates actually, they ask to us like how we can do it. So it is doable. I mean, you can do another test on day 5 and like come out of quarantine. So that's like the summary. So PLAB, so English, PLAB 1, PLAB 2, and then you can apply for the jobs. So I think that is it from my side.
Yeah, that is it, I think. Yes, nothing much from my side. Thank you for this wonderful presentation. I mean, a lot of things got cleared, 2, 3, even I also don't know actually, especially with the vaccine, amber, red list, green list, keep changing that, all these things actually. Yeah. So this is keep changing, guys. COVID is new for everyone. And we don't know how it's gonna change in coming days, but you just need to keep a good plan and then just go, look forward to go and finish everything with time, So I think, someday, you'll get there and, get a job at the same time. It's very much possible. That's one of the things.
Yes, sir. Thank you so much, Dr. Ahmad.
Thank you. That's a great opportunity for, I think, everyone to hear from you, actually. Yes. And hope you visit Bangladesh next time. Will be also a lot of things are pending. Visiting, take you to some of the places, which I mentioned.
I visited like 2 times, but I couldn't see whole of Dhaka properly because I was very tight on the schedule.
Dhaka is nothing much to see always. I mean, it's very tough to see because there's always traffic. But next time if you come, maybe 3 days extra, 2 days extra, just to go, out of Dhaka for You know, you can go to Cox's Bazar, the longest sea beach as well. I mean, just to have a look actually.
I'll just come to you. Will be my host wherever you'll take. I'll go.
No, it's definitely, yeah. So do that actually, and good luck to you. Thank you for your time, and thank you everyone for attending the session. So in conversation with Dr. Ankur actually. So thank you so much. And I think it was a good session. I think overall for both of us actually doing that. Thank you. Have a lovely day. We'll see just before going if there is any question. We'll just spend 2 more minutes if there is anything extra in here. Just before going.
What I can say is a question: is PT acceptable for a PLAB exam?
No.
No, it's not. It's only IELTS and OET.
Yes.
PT is not acceptable.
Not acceptable.
Should we mention that we are coming from PLAB 2 in case we have a family in the UK? Yes. So if you are coming to the UK for PLAB, it's always good to mention about the GMC confirmation PLAB 2 letter, and that yes, so we are coming here for PLAB 2, definitely. So I think these questions I could see in the chat.
Yeah, next one. I think do Australian citizens need visa to travel to UK?
I think you can answer that maybe.
Or is it airport entry in UK? I forgot that actually. You have to check the status, but that's not the point now actually, because Australian passport is one of the very powerful passport. We know a lot of countries has. But you know, the thing she wants to know is actually on arrival. Is it possible? Okay. See, it's a COVID days. You know, this is not going to work now. Even if it is a past, you were talking about a
What I know is like from US it is allowed. It's allowed like on arrival you're getting, but Australia I don't think so at the moment.
I also don't heard much about that one. I also have to check that guideline. And during COVID is very different. But one good news about Australia is a green listed country. Yeah. By the way, Australia, New Zealand is a green listed country. So in that way, you don't need the quarantine. That's the biggest plus point. So all I know from Australian citizen, what they did going to UK, they just apply online. You don't have to go take big hazard by waiting in that embassy and things. Those you don't have to do. You just fill up some of the forms and the things online, and then it will be done. Same if you go to Canada, even in USA, from Australia, that's how they do it actually. They apply online. That's also a form of getting visa confirmation and all your beneficiary details you have to give, and you'll receive it, and that's the confirmation actually. Yeah. Right. So that's the thing. Then you can go and on arrival, and those things are possible actually. Yeah. But as I said, still I have to check one time that because visa is different actually, because different country has different rules and regulations. So that's one of the things. Yeah.
Yes.
All right. And someone asked, pretty acceptable for PLAB? Not yet. Pretty not ever for. PLAB acceptable exams are IELTS, OET, and UKVI. These are the 3 exams that has been accepted so far. All right. Okay, I think so. I think that's all today, Doctor. So it's any last thing before you go actually to all the candidates, maybe 4th year, 5th year, anything, any wishes you want to do?
Yes, I just want to say like all the best, first of all. And secondly, PLAB is doable. It's not tough. They say like USMLE, they might be preparing for that. USMLE might be tough, but PLAB is easy. It's doable because it's just like undergraduate level exam. It's doable. And it's not like there's matching process like in the US.
Yeah, US has a big matching process.
It's a bit tough. Because even if you're not getting the training straight away, you can come here after passing PLAB, you can come here and join as non-training doctor. And when you are in the system, you can apply for the training every year. And once you are in the training, that's not a problem. So it's doable, and it's not.
UK is fastest, because I've been seeing a lot of type of license exam in my life, especially the USMLE, then this PLAB one, the UK, then AMC I've been tutoring as well. So UK, I figured out the fastest. Till you pass the PLAB 2 and get the GMC registration, and after that getting that job, that's usually the fastest in case of UK actually. It's, I would say, intermediate in case of Australia. It takes more time, I think, in case of USA actually, because of that matching issues actually. Depends on how good your caliber is. If you have, say, 5 years of gap, or if you have, if your passing year is not within 5 years, US asks a lot of things actually, which you may not be asked in UK actually. If you show somewhere that, you were engage in something, this is one of the things. Maybe some other day we can do a seminar, or maybe with any successful candidate about how they manage that job later actually, what are the documents they usually like to see. That's another very big thing actually. Maybe we'll continue that one some other day actually, because there's a lot of checklist. Any country, when you're applying for the job, from your police clearance to a lot of things that comes actually, So till then, some other day we'll catch up, I think. So thank you so much. I've taken a lot of time from Dr. Ankur already, from your busy schedule actually. Yes, you busy with classes, with a lot of things actually.
Yeah, so thank you so much.
When is your next immediate PLAB 2 batch? Coming up, because PLAB 1 result is coming up soon actually.
The next one is starting on 9th actually, 9th of September.
Oh, okay. And after that?
And after that, it's on the end, like say on 30th of September.
Okay. So every month, there is 1 or 2 batches goes on, right?
Yeah. So you can say like we have got batch for 12 days, and after 12 days, we have got 8 to 9 days gap, and then the next one will start. So every month we have roughly like 2 batches we have got.
All right. That's fantastic. Yeah. All right. So that's great. Very informative. And thank you so much, Dr. once again for
thank you so much.
joining and attending